Hi, this is Becky from More Than Borderline, and today I'm going to talk to you about a program the Indianapolis Metropolitan Police Department has called CIT. CIT stands for Crisis Intervention Training, and what that is these are officers who go through special training on how to work with people with a mental illness. And this program literally saves lives. CIT training initially started in Tennessee after a man with a mental illness was shot by the police and the shooting was found to be avoidable. We as a society had to decide, what are we going to do if a person with a mental illness has an encounter with the police? And these officers receive special training. They receive de-escalation training, which is basically how to calm the person in crisis down. They have some mental health training. For example, some friends of mine were on a consumer panel at the CIT training and performed a play relating to mental illness to give officers an understanding of what a person with a mental illness thinks or feels like. I can't say enough good things about the CIT training because I have had the police called on me in the past. It's not fun. It rarely ends happily. But when it's a CIT officer, it's different. One time, dispatcher sent a SWAT officer out to me, and I cracked a joke that why should I waste one bullet when the cop could use the whole clip, because that wasn't the most appropriate response. This guy's used to using force to solve a problem, and that was not what I needed at the time. But the CIT officers are usually able to calm me down, help me realize my need for help, and get me to the hospital. Thankfully, I haven't had to have a police encounter in several years, but the CIT officers know what they're doing. I think this program should spread to the country. So if you're a police officer and watching this video, Google Crisis Intervention Training and see what you find. You may save a life. And if you're a member of the general public or a mental health consumer, also do your research on crisis intervention training and go to your police department and suggest that they implement that program. It's literally a life-saving program because when people act in unusual ways and the police are called, the police need to know this individual has mental illness and respond with maybe a bit softer touch than they do when they respond to a crime in progress. Anyway, that's all I have to say on the subject, and I wish you a good day.